Happy November. I'm Janae, your Senior Information Specialist, and this month we're going to be focusing on home care. It's National Home Care Month, and I wanted to share with you all a little bit more detail about home care and some of the extra support services that we are able to provide as an industry. So a lot of you may have heard the buzzword in the healthcare industry right now is readmission prevention. And basically that just means that over the past decade, hospitals were readmitting patients for the same reason over and over again. And the government wanted to ensure that patients were getting the full proper care the first time instead of going through the medical system again and again. That would save the government money and also ensure safety of the patients. So what the government did about 5 years ago is they enacted a penalty for hospitals that readmitted patients within 30 days for the same reason as the initial admission. So because of this, hospitals have been discharging with a more full plan and a better plan for their patients, but the readmission rate isn't going down as fast as we all would like to see it. So a recent study done by Dartmouth University outlines the top 4 reasons why patients were being readmitted to the hospital. And we'll go through them real quick. It's patients not understanding their diagnosis. That's an obvious one. If someone doesn't understand what's truly wrong with them, they're not going to take care of themselves when they get home. The other one is mismanagement of medications, either just not picking up the medications from the pharmacy or taking them improperly. Again, because that could maybe be they're not understanding their full diagnosis. Another reason is they're not following up with their doctor within 30 days of their initial admission to the hospital. And a lot of times the doctor needs to see them, change up their medications, and maybe make some support service referrals to them for additional care, such as a walker or things like that to prevent a fall. And then the final main reason for readmissions to the hospital is the families not truly understanding the care needs of the patient. So what I wanted to share with you all is how home care has such a huge role in being able to prevent readmission, specifically private duty home care. So private duty home care is set up to be the support service at home for all of those non-medical needs. So for instance, if someone is having trouble understanding their diagnosis when they come home from the hospital, private duty home care can send in a nurse to provide education to that patient about maybe it's a diagnosis of diabetes or congestive heart failure. The patient needs to know the severity of their condition for them to be able to be compliant with their medications or their treatment plan. Another instance how private duty can help is with that second reason of why people are readmitted to the hospital of medication errors. Well, a private duty nurse can come in weekly, set up medications for that patient, reorder them on a monthly basis, and then we can provide a private duty caregiver to come into the home daily or at the convenience of that family to remind the patient to take their medications. Another easy fix for preventing a hospitalization is, well, like I said, the patients aren't going to their doctor after the hospitalization. So we could easily provide escorted transportation for that patient. We could take them in our vehicle, or we could use the vehicle of the patients if they are willing to sign a waiver for that. What we can also do is have a nurse case manager make the appointment for the patient, which is a really nice service. We can set up all their physician appointments, all of their rehab appointments, so that we can ensure the patient is following up with their care. And then finally, a lot of times the families are not fully equipped to care for that patient's new needs once they've come home from the hospital. So we can provide respite care for the family, and that's just short-term care that we're providing in the home for the patient to give the family caregiver a break. That can be from literally a couple hours to a couple weeks. If that patient, if the family wants to maybe take a vacation or just get some TLC so that they can be fresh to take care of that family member again once they've recovered. So those are just some solutions that private duty can provide for patients to prevent a rehospitalization, but of course private duty can prevent the initial hospitalization as well. So if you have a concern for a loved one, either that they may be readmitted to the hospital or you'd like to prevent that initial crisis, please call us. You can call us anytime. We're open 24 hours a day, and we'd love to hear from you. We'll put the number at the bottom of the screen, and you can also visit us at bayshorehomecare.com. Happy November, everybody. Bye-bye.